Hello, good evening, everyone. Thank you for joining us at our third and final Let's Talk About Sex live event here in Facebook. Today, we're going to discuss a very interesting topic that we think the community will definitely benefit from. Um, just a few housekeeping rules before we are done with the program. You all can complete a survey it's just asking a few simple questions so you all can let us know how we're doing in areas that we can improve. And in doing so, you will be able to participate in a draw, and you might win $50 gift certificate. So don't forget to go ahead and complete that survey at the end of the program. So with no further ado, I will go ahead and start by introducing our teammates here. In the prep program here at True Health. And then afterwards, we will begin with our topics for today, which is risky behaviors as it pertains to HIV. So I am Dr. Luisa Mena. I am the medical director, and I am the program director for PrEP. I will go ahead and pass it on to Bernadette Pearson.
Hello, everyone. My name is Bernadette Pearson. I am an RN HIV case manager. And next we have Gil.
Good afternoon. My name is Gil. I am the center manager for our Southside location. Next off, Giovanni.
Good afternoon. My name is Giovanni. I am the center manager for the Lake Underhill location. And next I will pass it on to Jeffet Rios.
Good afternoon, everyone. My name is Jafet Rios, and I serve as Regional Director of Operations for True Health. I'll take it back to you, Dr. Mena.
Thank you, Japhet. So I want to discuss the importance of behavioral health and PrEP. So as you all know, PrEP is pre-exposure prophylaxis. It is a medication that we offer here at True Health to help people that are at high risk for getting HIV not to get HIV. So it's a pretty easygoing pill, one a day. And if you follow instructions by your healthcare provider, you will reduce your risk of getting HIV by 99%, which is pretty good. So we have here a behavioral health program to assist our patients that are thinking about PrEP or on PrEP or are wanting to recommend someone on PrEP. And what the behavioral health team does is that they provide a risk modifying behavior counseling so that our patients that do go on PrEP are ultimately given the decision to get off PrEP and modify their risky behaviors and hopefully not have to go on PrEP. Now, also, we do have counseling for those that would like to remain on PrEP for an extended period of time. And the counseling would just make sure that we remind them and help them to live as safe and healthy as possible. So anyone that joins PrEP through our team will have counseling with our behavioral health department. They will see a counselor there every 3 months. They will talk about risk behavior modifications. They will talk about HIV pre and post counseling, as well as results. Questions will be answered, and if they need to be connected with any resources out in the community, they would do so as well. So I just want to make sure that we all understand the importance of behavioral health with PrEP. We don't just want to give out a pill and send you on your way. That is not the way True Health does it. We want to help you to modify your risky behaviors and help you understand how making bad or good decisions can affect your overall health in the future. So with that being said, we're going to have Jafet Rios, our Region 2 Director of Operations. He's going to go over just a few details and information on True Health, the services that we provide. And then Bernadette is gonna, I'm going to talk about risky behaviors, and then we'll have Bernadette, Gil, and Giovanni talk about, we're gonna, guys, help me out here. Statistics, and as well as myths and misconceptions about PrEP. and Bernadette is going to talk about how to join PrEP here in True Health. So with that being said, Jafet, I'll kick it on over to you.
Thank you, Dr. Mena. So just to provide an overview of True Health is a federally qualified health center here in Central Florida. Since 1977, our mission has been to provide high quality, comprehensive healthcare at a reasonable cost to everyone. For over 45 years, we have been achieving this mission and have been committed to creating healthy communities through life-changing care. We have 8 locations, 4 in Orange County and 4 in Seminole County. And then some of the services that we provide include adult care, podiatry, pediatrics, lab, pharmacy, obstetrics and gynecology, optometry, behavioral health, psychiatry, dental, x-ray, and our outreach and enrollment team that specialize in providing in-person or telephonic enrollment assistance in programs like Medicaid, KidCare, and the federal health insurance marketplace. So that's a little description about our organization. I will kick it back to Dr. Luisa Mena. Dr. Mena?
Jafet. So now we're going to go ahead and discuss risky behaviors and what those behaviors look like and what we can do to decrease those risky behaviors. Next. So in the United States, as of about maybe 40 years ago, we began with this epidemic on HIV. And I think everyone has done an amazing job with trying to organize, trying to put out campaigns, trying to educate the community to decrease these infection rates. And the United States have come a long way in this stride to reduce HIV cases, as well as bring about more care, treatment, and just more education overall to the community. As you all may recall, back in about 1984, when the epidemic started, actually HIV was the leading cause of death in young people. After a lot of research, after a lot of going back and forth with the FDA, medications, clinical trials, we've come about with a lot of retroviral medications, and that has decreased these death rates. So people that are infected with HIV are now living longer, they're living healthier lives. And those that do not have HIV are able to remain HIV negative if they follow certain recommendations, if they have an HIV positive partner. Now, the rate for new infections has declined about 73% between 1984 and 2019. And the death rate has dropped more than 80%. That is really, really big since its peak in 1995. So that's tremendous, tremendous work there. However, what we're seeing now is that this progress has decreased, or it has stalled somehow. And because of this reason, we are trying to join in this big movement of awareness out in the community, so that people can know their status, so that people can know about pre-exposure prophylaxis PrEP, and so that people can realize and understand that taking medications can slow their rate of infecting others, as well as their overall health. Next slide, please. So in the United States, there's 2 main ways that HIV is mostly propagated. It's not to say that there's no other ways, but the 2 most common will be through sex and also through sharing needles. So anyone that has unprotected sex with an individual that has HIV has a risk of getting infected, as well as anyone that injects drugs via intravenous and shares needles and happens to share it with someone that is infected, you know, they are more likely to get it. So those are your 2 causes, mainly causes in the United States. However, other things, like I said, can contribute. Substance abuse or substance use, even if it's not through IV needle using, can still be a risk. Why? Because when you're under the influence, this can slow it can lower your inhibitions. And so you're more likely to make not, good decisions. You're more likely to have unprotected sex. You're more likely to maybe engage in other risky behaviors that can expose you to getting HIV. Next. As far as getting HIV, really is going to vary a lot on the person's exposure and what particular risk we are talking about. Some exposures to HIV may be higher, like I said earlier, unprotected sex or sharing needles could be higher than others. However, it doesn't mean that lower risk will not, by time, if the person continues with the same behavior, it will increase the risk of the person getting HIV. So these risks, if we attack them or educate, I should say, the community in ways that you all understand what those risks are, and it doesn't matter how little or small you may think they are, if you continue the behavior, they will eventually, get to be a risk for the person to get HIV. So we want you all to realize that it doesn't matter how little or how big the risk is, it's the behavior, it's the continuation of your behavior that will get you to be at that high level of risk of getting HIV. Next. So when engaging in any risky behavior for getting HIV, we have to consider the partner, who you're with. Is this person HIV positive? If they're HIV positive and you're having a one-time exposure to this person, obviously the risk of getting the HIV virus is lower. However, if you continue having a risky behavior or sexual intercourse with this person that is HIV positive repeatedly, then obviously your risk of getting HIV are much higher. Next. So we looked up some numbers, latest numbers per CDC, FDA, and the World Health Organization, and came up with the probability of acquiring HIV from infected sources. Now, I've pointed out a few of the most common HIV transmission sources and how that would compare to 10,000 exposures. For instance, the first exposure there is your parental, meaning blood. So this would be blood transfusion or sharing needles through IV drug use, or percutaneous needle sticks. These are the healthcare providers that might accidentally prick their finger while drawing blood or putting on an IV and stuff. So blood transfusion obviously is the highest risk factor. This is going to really give you almost 95% chance that you will get the HIV virus if you inoculate yourself with someone else's blood that has it. So with blood transfusion, out of 10,000 exposures, it's supposed that 9,250 will get the HIV virus. With needle sharing, 63 will get the virus out of 10,000 exposures. And then with the needle sticks, 23 will get the virus. And with the needle sticks, obviously it's a smaller amount of blood. Sometimes the person is able to squeeze, some of the blood out if they catch it on time. So the risk is still there, and 11, infections will occur out of 10,000 exposures. Next. Continue on with the sexual exposure, receptive penile or vaginal intercourse. 8 out of 10,000 will get the virus, and then insertive penile vaginal intercourse, 4. Now, when we say receptive, what that means is that the person that is being receptive is receiving the penetration. And when we say insertive, that means that the person is not penetrating, but not being penetrated, but penetrating someone else as it pertains to the sexual activity. Same thing goes for receptive oral intercourse and insertive oral intercourse. Those risks are lower, but like I said, even if the risk factor is low, with repeated behavior, doing so can increase the risk of someone ultimately getting the virus. Next. And then the other type of exposures, we have the biting, spitting, throwing body fluids, and sharing sex toys. These, out of the 10,000 exposures, these are negligible because they are such low risk that really they're not really measurable. They haven't really been able to pinpoint a specific case. However, anything repeatedly that can be a risk, I'm going to repeat that today a lot, will ultimately turn into a higher risk, and the person, can get the HIV virus in the end. Next. And some of the factors that may increase risk of HIV transmission would be your sexually transmitted diseases, acute and late stage HIV infection. And that is because the person would have a high viral load. So if you have a lot of virus in your blood and you come in contact with someone else sexually or sharing needles, of course, there is a much higher risk of you getting the HIV virus. And of course, those that decrease the risk, and we've talked about it in our previous events, would be condom use, male circumcision, antiretroviral treatment, and pre-exposure prophylaxis. Next. Now we're going to go ahead on with Giovanni. He's going to talk about HIV statistics.
Hi, how are you doing? So I'll be talking to you guys about HIV statistics today, predominantly in Central Florida. Next slide, please. Awesome. So about 117,000 people live with HIV in Florida, but of those, 13,070 live in Central Florida. This is based on 2020 data. When we look at it by sex, we can see that males occupy 76%, while females were at 24%. When we look at it by race or ethnicity, we can see that Black folks were at 38.3, Hispanic and Latinos were at 30.7, and then white were at 28.5. When we break it down by age, we can see that between the ages of 25 and 59, there was about 75.6% of individuals living with HIV at that time. Next slide, please. When we look at new diagnosis in 2020, we see that 506 people were newly diagnosed in 2020 with HIV. Of those, 82% were male, 18% were female. When we look at it by race or ethnicity, we can see that Black folks were at 40.5, Hispanics were at 37.9, and white were at 19%. When we look at it by age, we see again that between the ages of 25 to 59 are about 60% of the scale as well. And then when we look at the 13 to 24, we see 21.5. When we look at the last 5 years, we see that there was a trend for the first four between 2016 and 2020. From 2016 and 2019, there was a trend that they were in the 600s. But then in 2020, we saw that we went down about 150 for newly diagnosed. And the belief is that this happened because of COVID, lockdown. A lot of people were not going out, so there wasn't a lot of engaging going on. However, there's some belief that those numbers are gonna go up when recent data comes out. When we look at the late HIV diagnosis in 2020, we can see that males are at 18.3, while females were at 27.5. When we look at it by ethnicity or race, we can see that Black individuals were at 21.5, Hispanic and Latinos were at 19.3, white were at 16.7. And then when we look at it by age, we see that individuals who were 60 and over were at 31.7, followed by individuals between the ages of 45 and 59 at 28.2. The HIV prevalence rate ratio based on race and ethnicity in 2020, the rate of Black male living with HIV diagnosis is 4.0 times that of a white male. The rate of Black females living with HIV diagnosis is 16.9% times that of a white female. The rate of a Hispanic Latino male living with HIV is 2.2 that of a white male. The rate of a Latina Hispanic Latina female living with HIV diagnosis is 5.3% that of a white female. When we look at the risk factors and we break them down by sex, we see that Males who have sex with male are 72% of the scale of risk factor. That's one of the main causes of HIV diagnosis on when it comes to males. And then when we look at females, we see that heterosexual contacts at 74.2, sorry. Of the 1.2 million people living in the United States and Puerto Rico who could beneficiate from PrEP, only 25% of people were prescribed with PrEP in 2020. And this, you can see basically that California, New York, Massachusetts, Florida are kind of on the higher percentage of people who are utilizing PrEP. And then the ones that you see on a lighter shade color are where PrEP is less utilized. That is it for my presentation. I'm gonna pass it over to Gil.
Good afternoon. So today I'm going to be talking about the myths and misconceptions of PrEP. Next slide, please. The 10 most common myths about PrEP. PrEP is only for gay men. PrEP is honestly for anybody that's showing high-risk behaviors. Again, unprotected sex, sharing needles, things like that. Condoms are not needed if the person is currently on PrEP. PrEP is only preventative against HIV against HIV. It is not a preventative for other STDs. It is hard to get a prescription for PrEP. Typically, any licensed medical provider would be able to prescribe PrEP. PrEP is needs to be taken after having unprotected sex. PrEP should be taken, again, if you're identifying those high risk behaviors. Again, if you're sharing needles, if you're having unprotected sex, if a partner of yours is exposed to any STDs or has HIV, then PrEP would be something to look into. PrEP is expensive. PrEP is only for people who have multiple sex partners. PrEP is not needed if you're a top. PrEP should be taken every day. PrEP has bad side effects, and a patient will need to stay on PrEP for the rest of their lives. A patient would only need to be on PrEP, meanwhile they're still exhibiting those high-risk behaviors. If at some point they do modify those behaviors and they stop showing those, stop sharing needles, having protected sex and things like that, at that point, then the main goal is to be able to get off PrEP. And aside from the myths and misconceptions, I will now pass it off to Ms. Bernadette.
Hello, everybody. So I will be talking about Stay Ready with PrEP. So here at True Health, we are pleased to offer the PrEP program. It is funded by HRSA, and we offer the PrEP program to everyone at no cost to them if they qualify. Next slide, please. So when taken as prescribed, the PrEP medications are highly effective and preventing a person from catching HIV from sex or injection use by 99%. Next slide, please. So the next question is PrEP right for you? Well, if you feel that you don't regularly use condoms, have a sexual partner who has HIV, you've had unprotected sex in the past 6 months, you've been diagnosed with another STD within the last, or if you have shared needles or syringes to inject drugs in your system in the past 6 months, are a female and have a partner that is positive with HIV and are considering getting pregnant. Next slide, please. So how to enroll in the PrEP program? After a patient has registered with True Health, the provider can order the necessary PrEP blood work, which can usually be done after the initial visit on their way out. I would be notified, the HIV case manager, in order to schedule the remaining appointments for PrEP that's needed to stay in the program. And also, if you're uninsured, I do assist to get the medication through Gilead if you cannot pay for the medication. And I'll turn it over. Oh, requirements to stay in the PrEP program. The requirements are you will get lab work every 3 months. Also, PrEP counseling every 3 months and a visit with a True Health provider every 6 months, which would be a physical, at no cost to the patient. So it's just a matter of committing to the required appointments to stay in the program actively. And I would be the one that would be reminding you, reaching out to you, getting all your appointments in place to keep you current with all the required appointments that are necessary to continue to stay in the program. Next slide. I think we'll be introducing Dr. Mena.
Thank you, Bernadette. So very important information for you all. If you yourself or if you know anyone that may benefit from our program, please go ahead and let them know. Send them our way. We will prepare them. We will connect them with counseling here at True Health. They will meet a behavioral health counselor. They will meet our providers. They will be able to get blood work, their physical exam, because we want them to make sure that physically they're able to start PrEP, and we will provide the education as well as the medication. So having no insurance will absolutely not be an issue. We do have our manager, which is Bernadette. She's our case manager, and she connects the people with the Gilead prescription program. If the person has insurance, they can still get assistance with their copays. And Gilead provides up to $10,000 a year for copay assistance. So there is absolutely no reason financially as to why someone cannot be on PrEP. We will absolutely take care of that and make it happen, as well as continue to test you to make sure that if the person is on PrEP and continues with risky behaviors, we test every 3 months to make sure that they remain HIV negative. And if there's any other infections that may come up, we also treat them as well. So big things to keep in mind to reduce your risk of getting HIV is number one, connect with your healthcare provider. If you don't have one, we welcome you here at True Health. We welcome patients that are new, patients that have no insurance, patients that are underinsured, and patients that have insurance. Doesn't matter immigration status, come on board. We welcome you. So that's your first step. If you or someone you know is at high risk, is contact us. Start modifying your behaviors based on the information we provided here today. You can also log into your local health department website. They have a lot of information on sexually transmitted diseases, on HIV, on PrEP. You can also log on to the CDC. They have a lot of information. They have also most frequently asked questions and answers. So that's also an extra resource for you to educate yourself. Using condoms consistently if you can. If you have any symptoms or suspect that you may have been exposed to a sexually transmitted infection, reach out to your healthcare provider right away. You know, I know a lot of people want to go on Google, but that's not the correct way to do it. You must see your healthcare provider. If you know someone, sometimes some people might be shy or fearful of, disclosing, but absolutely give them our information, and everything here is anonymous. We don't share healthcare information without anyone, any resources, unless the patient consents to them. So that's not something to be fearful about. So with that information that we give you all, we want to go ahead and open it to questions. If you guys have any questions, any comments, concerns, any thoughts, now is the time for you to come on board and ask your questions. While we wait for some questions, I want to invite you all to two events that we have coming up. It is called KISS event, Know Your Status Sooner. We will have an event this coming Saturday at our Lake Underhill location. It starts at 10 and it ends at 2. We're going to be doing rapid HIV test at no charge to you. So if you or someone you know, your neighbor, your family members, coworkers, go ahead and send them our way. We can test them, rapid HIV testing, 20 minutes, you get results. We will also be offering a free take-home HIV test where the person can perform the HIV test at home in the privacy of their own home. Some people might not want to come in because they're shy or embarrassed. Well, no worries, we got you. We can provide you with the take-home test, and we would have someone to call you and follow up with results and give you some instructions from there. We're going to have a speaker, very knowledgeable. He's an expert in the field as it pertains to HIV and PrEP. He's coming from up north New Jersey. He's very, very well known up north in New Jersey, and he's going to be with us Saturday and Tuesday. He will talk to the community about HIV, about PrEP. He will be ready to answer questions and just engage with the community and bring some valuable information to you all. So that would be this coming Saturday. Our second KISS event would be Tuesday, the 27th. That one, we're going to be doing it at our airport location. That is in Airport Boulevard. We have flyers on our website. 10 to 2, we will be there. We will be having some tables with information, some things that you all can take home, small gifts. And we would absolutely be ready to answer any questions. The health department is in the same building. They will be also performing some rapid HIV tests. So if you have the time, if you're in the area, come on by, stop by and visit us. This Saturday, 10 to 2, and Tuesday, the 27th, 10 to 2. Let's see, do we have any questions? I don't see any questions so far, but we'll hang around. I know a lot of people are probably gathering their thoughts and thinking about what they want to ask. So we're here. We, as Jafet mentioned at the beginning of his portion, he talked about the services here at True Health. We have 8 locations, soon to be 9 and 10, and growing. And in our locations, we have a lab, so patients could come in, get their blood drawn, they can see their provider. We have 5 locations with pharmacies, so you can not only see your provider, get your blood drawn, but you can also get your medications. So it's a beautiful thing to be able to do that. We do provide pediatric services, family medicine, OBGYN, behavioral health, optometry, dentistry. So if you or anyone you know needs our services, we are here. Like I said earlier, doesn't matter if you don't have any insurance, doesn't matter if you're not able to pay, and it surely doesn't matter what your immigration status is. So we do have a question, and someone is asking if PrEP has to be taken with certain medications. No, people that do not take any medications can go on PrEP, and people that are on certain medications for health conditions can still be on PrEP. So there isn't any restriction when it comes to medications. The most important thing is to make sure you let your healthcare provider everything that you take as far as medications, and make sure you have that open communication so that we can prescribe it safely to you, but there are no restrictions with medications. Can PrEP be taken while breastfeeding? That is a good question. All of our patients that are looking to get pregnant or are pregnant, we consider them high risk if they are on PrEP, because we want to make sure that they follow instructions carefully and that the baby is monitored closely. So we refer them to maternal fetal medicine. I just wanted to put that out there. But yes, while breastfeeding, the person is able to be on the PrEP medication. There is, after several trials, it has been found that there's a very small percentage of the medication that passes through the breast milk, not enough to be harmful to the baby. So women, yes, can be on PrEP while breastfeeding. What are the side effects of PrEP? Side effects of PrEP, obviously it's going to depend on the individuals, but the most common ones could be headaches, nausea, vomiting, body aches. But the good thing about this is that these side effects are most of the time transient. So the person can start PrEP and can experience these side effects for the first week or two. After the second week, these side effects begin to reduce. And as a way to combat these side effects, we have our patients take certain over-the-counter medications. We give them a list. Bernadette educates them thoroughly on side effects and what medications they can take if they get a headache, if they get body aches, if they have, any symptoms in their stomach, nausea, vomiting, or diarrhea. So we closely monitor anyone that reports side effects, and we monitor them until these side effects subside. In some instances, if they don't, then we have other options. We don't have to keep you on just that one PrEP medication. We have Truvada and we have Descovy. So any of the two can be interchanged. If exposed, is there a medication to assist with exposure? Yes, there are medications, and that treatment is called post-exposure prophylaxis, or PEP. And that treatment consists of obviously having the person come in as soon as possible, testing them for HIV to get a baseline. What that means is that we want to make sure the person wasn't already HIV positive. And then we will test them again anywhere between 6 and 8 weeks later, because that is when the window period for HIV would have passed, and the person would have enough virus in their blood to come back positive in the test. But in that interim, the patient is started on medications prophylactically to prevent the virus from replicating or from staying alive in their body. And those treatments for post-exposure are very, very, very good treatments. I would say 92% of the people that are exposed to HIV and don't have a previous infection with HIV are able to stay negative. So it's important that if you suspect you had an exposure, contact your healthcare provider as soon as you can. Can PrEP be taken along with the use of social drugs such as alcohol and marijuana? Ideally, we don't want, medications to be taken with any alcohol or any other recreational drugs like marijuana. However, doing so will not get anyone out of the program. We absolutely can help assist with counseling if there's any sort of a problem with alcohol or any other drugs. But understand that taking these medications and having a cocktail or smoking marijuana is not going to increase your risk of getting, the virus. However, anything that is metabolized in the liver, like alcohol, can reduce the efficacy of the medication. So our counseling sessions and our risk behavior modification consist of education with all those subjects in mind, just to make sure the person is well educated and makes conscious and wise decisions. When would PrEP not be recommended? Well, the only time that PrEP is not recommended is, number one, if a person is already HIV positive, this person will not obviously be on PrEP. They will be on other retroviral medications, and it would be a completely different treatment altogether. And anyone that has bad kidneys. So we want to make sure everyone's kidneys is nice and healthy before starting on PrEP. And the reason is that these PrEP medications are metabolized in the kidney. So we want to make sure the person has healthy kidneys to begin with. It is not that the medication will damage your kidneys, but rather that they're metabolized in the kidneys. And in order for that metabolic process to take place correctly, the person should have healthy kidneys. So those are the only two things. Now, other than medically, obviously, a person that is not consistent with taking medications, or anyone that we suspect will not adhere to the treatment, will not be a good candidate for PrEP. Those are good questions. So I want to quickly remind you all to please complete your survey. It's a short survey. And with that survey, you will be helping us. We would know, where we can improve in, what areas we can modify maybe, and what other information the community will benefit from. So make sure you complete that survey, and you will enter to win hopefully a $50 gift card. So that would be a nice thing to do. So you walk out with useful information and the possibility of getting $50 gift card. Doesn't get better than that. Any other questions? We'll just give it a few more minutes. Okay, I see no more questions coming in. So again, I just want to remind you all, complete the survey before exiting, and make sure that you recommend our PrEP program and our services here at True Health if you come across anyone that you think needs the services or may benefit. You all stay safe and have a good day.